All right, what am I doing wrong here? Oh, here we go.
Freeman,
Present.
Berkowitz,
Here.
Costa, Dean Schlappman,
Here.
Hickey,
Here.
Mitchell, Butler.
Here.
We have a quorum.
All right. Okay, first I'd like to get a motion to approve minutes for the July 3rd meeting.
Motion Dean Schlappen.
Second, Hickey.
Roll call?
Freeman,
Present. Yes.
Berkowitz,
Yes.
Costa, Dean Schlappman,
Yes.
Hickey,
Yes.
Mitchell,
Yes.
Butler.
Yes.
Motion passes.
Okay, and as we make a grand entrance, our first, well, we have no old business, but as far as new business, we have Anna Payton. Why don't you just keep coming right up to the front here? She's gonna give her presentation for Will County Animal Protection Services. And if you'll hit your button.
All right, I had submitted a PowerPoint ahead of time. I don't know if we can pull that up. Amazing. Okay. So those of you that don't know me, I'm Anna Payton. I'm the administrator with Animal Protection Services. So I just want to give a little overview of our department and some of the things that we've been doing. So first and foremost, our mantra is that we help animals by serving people, and that's really, really important. So just a little bit of data for you guys for 2024. Our intake last year was 870 domestic animals. Our primary animals that we serve are dogs and cats, but we serve all domestic and companion animals. So that also included rabbits, chickens, guinea pigs, and pigeons. Last year, we had over 12,000 incoming calls by residents calling us for assistance. Our animal control officers responded to over 1,200 calls for service, and also investigated over 1,100 bite reports. So we handle all the bite reports for the county. If a person is bitten by an animal, follow up to make sure rabies control is in order. And then we had over 80,000 rabies tag registrations. That's actually how we're funded. Our primary source of revenue is rabies tag registrations. We are not funded by the general fund. We are non-tax based department of the counties. We are self-sufficient. So not only is that important for our operations, but again, goes back to public health and safety, making sure the dogs and cats in our county are registered and vaccinated against rabies per the Illinois Animal Control Act. So next slide. Some highlights from last year, some of the things that we were doing. We did a rebrand of the organization with a new name and logo, which you can see right there. We had previously been known as Animal Control, and we're now Animal Protection Services, which I think is more reflective and indicative of the services that we provide the community. So it was really exciting to see. And our logo, of course, reflects that we do more than dogs and cats with our little rabbit friend in there. And it's all the small things, but we have the license on those dogs and cats. So, you know, subliminal messaging. We want those rabies tag registrations happening. We revised the ordinances, which had not been done for quite a while, which is really good. So they're now in line with the current state law, which is great. And then focus on specific needs of the county. So that was wonderful working with the county board to get that passed. Also, we provided free microchip scanners to the sheriff department and area fire department. So really trying to lean into if animals do run off, that we're able to return them to their owners. That's our goal. We don't want them at the shelter. We don't want to take them in. We are happy to do that, and all my staff is very good and loves the animals. However, if we can get them home to the people who love and miss them more quickly, we want to do that. So providing those additional resources is great. And then we also revised and renewed our IGAs with our 15 municipal partners that we had. So again, appreciated working with the county executive and the county board in order to accomplish that. Next slide, please. Some other things we did last year, we increased our relationships with local educational organizations, including JJC and Wilco. So we work with JJC, their vet tech program, to supply them animals during the semester. So those students that are learning how to do medical, they have the opportunity to blood work, learn how to assist spay neuter with a licensed veterinarian. So these are all great services that they're able to do with our animals that are not reclaimed by their owners. And then historically, what ends up happening over the course of the semester is those students and or their families or staff fall in love with them. And so they get adopted by semester end, which is a really beautiful relationship to see. And then working with Wilco with their animal care program for the high schoolers, we've done shelter days where they get to come in and do tours and do like enrichment projects and different things like that. So it's a really good opportunity for those students to learn as well. In addition, those locations were added for our Home for the Holidays, which is a free microchip promotion we do in the month of December for Will County residents. Again, microchips, if you're not familiar, is a permanent form of identification that's implanted in dogs and cats, rabbits and ferrets as well. But that way they can't lose that like a tag. So we can scan the back of them and a number comes up and that number is registered to the owner. So again, we're able to get them home more quickly. And so giving the opportunity for those students to also help with not only the microchip process, but really seeing how to serve the community is really important to us. So they joined us last year for offering that in the month of December. And I'm proud to say that in 2 years of this program, we've microchipped almost 400 animals owned by Will County residents for free. So very proud of that as well. Okay, next slide, please. We're not done with the highlights, sorry. We're very busy and do a lot of great things, so I'm very proud of that. We also host SNP Society, which is a low-cost vet clinic based in Joliet, but we host them at our location the third Saturday of each month from 10 to 1, and it's for Will County residents only. And they provide low-cost exams and vaccines. And again, we provide microchips for free. So if the animal's not microchipped, they will be microchipped for free with the goal, again, if they happen to get away from their owner, we're able to return them to them more quickly. But this is a really wonderful service to offer. Many people experience financial hardship during different points. And we want to make sure that we're doing what we can to keep those animals in the home. Some people think, well, people can't afford to have a pet, they shouldn't have it. We don't have that perspective. I always say the amount of money that you have does not equate the love you have in your heart. And sometimes people going through a rough time, those animals might be the last solid rock or foundation that they have. So we want to do what we can to help them maintain ownership. So we're very proud to continue that partnership with SNP Society as well. Okay, next slide. A new program that we had started in 2023 is our Whiskers at Work program. So we fully vet feral cats as working cats. So feral cats are typically cats that are born outside in the wild, away from a home environment. So while those cats are domesticated, they're not used to people. And so people are kind of scary for them and they have no interest in being snuggled or living the house life. So historically, prior to this program, those cats were unfortunately euthanized. But now with this program, we're able to spay neuter them, vaccinate them, microchip them. And then because Will County has such a large rural population, there's many farmers and people that own horse properties that are looking for that organic mouse control, as we say, that are trying to eat their feed. So they are able to adopt those free of charge, and we give them information about how to introduce them to their property, which is really great to see. So we placed 23 cats in 2024. We've already exceeded that number this year. So this year is going to be a very high year for us. So another program that we're very proud of to have positive outcomes for the animals and to provide a different and unique service for our residents. I will say the Will County Farm Bureau was very interested when I called them initially and was like, hi, and introduced myself, because sometimes animal welfare and the ag community don't necessarily see eye to eye, but when I explained to them what the program was, they were super excited. And so we're in their newsletter and they put us in the Farmer's Almanac, I think, or whatever the farm publication is. So we're building relationships and partnerships. And I know not my knowledge base, I'm sorry, but yeah. But I appreciate that. And so again, just kind of building those relationships in the county is important as well. Okay, next slide, please. Oh, look at all these happy things. So 2024 was the first time we did adoptions in the history of the organization. And so just wanted to share, those are all animals that were adopted from our shelter after their adoption. So you can see they are living the life very nicely. A lot of couch pictures there. I don't know the people that adopted that same bird. I'm not sure where they sit, but you know, he's enjoying his time on the couch. And then that white dog in the middle actually does visits at assisted living and nursing homes to visit with residents. So is serving as a therapy dog. So some really positive stories that came out of that. All right, next slide. Moving on to 2025. We started this year with multiple cruelty cases, including one that actually involved horses, donkeys, chickens, dogs, and cats, all at a residence where they were abandoned. So that dog there, Hero, Hero is the reason why that property was discovered. By the grace of God, Hero escaped, and Beecher PD, as you can see in the picture there very nicely, was trying to capture Hero as she was running down a 2-lane road, and Hero led them back to that property. So that's how those animals were discovered, and they were in horrific condition. One horse was unfortunately already deceased due to starvation. So just really, really terrible situation. And so again, just wanted to highlight and call out that we do serve animals besides dogs and cats, and we have some really challenging cases at times that we work through. And that was a multi-agency collaboration between us, them, the sheriff department, University of Illinois, in order to work through that case. Hero, as probably one of the most positive outcomes out of that case, Hero not only survived and thrived, but now she was adopted by somebody at the state's attorney's office and is one of their care canines that work with kids. So she is out serving the community now. And the PD was just thrilled. They wanted to give her a key to the city. Like I was getting calls all the time from the chief wanting to know an update for Hero. They named her. So it was just a really beautiful outcome to a very sad situation. Other things this year, I know we're just wrapping up our high school internship program for the summer. We actually had one of the highest applicant pools. We had 38 applicants apply for our high school internship. This was the first year that we offered it. So it was really wonderful to see that many students interested in what we did, and certainly plan on offering two spots. I can't do 30, but at least 2 spots next year to help more students have a positive experience and learn about what we do with the community and the animals. We added a field services supervisor to increase community support and compliance. So that position oversees our officers. Again, as we're seeing more complex cases come through, we need that additional support to help work through them in a positive way. And then we're going to be increasing resources with a mobile vet vehicle and livestock trailer as well. Last week, we just had another call for a loose horse at 3 a.m. when all great things happen out in Homer Glen. And so it's just really important if you look at, we don't look at just our department resources, but we look at the county resources as a whole. So obviously the sheriff went out initially, but we really feel it's important that, again, since we do have a large ag population still in our county, that one of us needed to have a livestock trailer, either emergency management, the sheriff, or us, and it just makes the most sense for us to maintain it. But that way we have that resource available if something happens. So just kind of building up our bandwidth, if you will. All right, all the good things. Moving on, our current challenges. Okay, space. Have any of you been out to our building? A couple of you. If you have not, please come on down. I'm happy to show you around. I've been there a little over 2 years. The building was built and opened prior to my arrival. So I can just speak to what it is now. The plain fact is our building was not built to house animals. It just wasn't. There was the previous operations of the organization prior to COVID was that our department did not house animals on site. They were all housed at vet hospitals for their stray hold. After the stray hold ended, they found placement either through other agencies or through those vet hospitals. We all know COVID happened. When COVID happened, all of those contracts went away and they aren't ever going to come back. It's just the vet hospitals do not have the bandwidth, nor do they really recoup their cost. And they're not trained to handle what we handle. Vets are very good at the medical side, but if we're looking at behavioral cruelty cases, adoptions, things like that, most of them, they just don't have the training or the bandwidth to do it. So unfortunately, our building was not built to house animals. I can't emphasize that enough. 3% of the footprint of our building was built to house animals. That is 225 square feet out of a 6,700 square foot building. So we're talking about less than the size of this room has 5 dog kennels in it. And those are kennels that are built for post-op, which would be after spay neuter recovery 24 hours, not a 7-day straight hold. So when you think about 5 dog kennels, and I said we had almost 900 animals last year, it's just not feasible, right? And so I will say, you know, effort was made prior to my arrival. They retrofitted the 2 garages and added dog kennels there. They put cat cages in the lab room, tried to make it work. It's just not sustainable, and it's not built to house what we need. So we've had issues with the HVAC system. We had significant issues with the plumbing and the sewer beginning of this year, like sewer gas to the point like I thought we were gonna have to evacuate the building because it's not built to drain out animal waste for all of that stuff. It's a huge problem. So even just looking at fixes like that, I was given an estimate to fix our plumbing, for example, $55,000. Like, it's just, it's not appropriate, and we can't just keep putting a Band-Aid on a gaping wound. It's the end story. Also, it's not set up for a variety of species. It's inappropriate to have cats in with dogs. It's inappropriate to have your prey animals like your chickens, your rabbits and stuff in with dogs or cats. It's think about it, their stress levels will be through the roof, which causes them to be sick, which causes your medical costs to increase. Also with just facilitating adoptions, because we don't have separate space for people to come in and meet the animals. We were using our conference room. Outside is great when the weather is nice for the dogs. I would like to call out though, too, we were built next to the sheriff department. I love the sheriff department. However, their gun range is out there too. The guns going off is not only frightening to the animals, but it's unsettling to the people that come in. I had people, members of public comment, what is that noise? Oh my gosh, are there guns going on? Like, they just don't know. And it's just not kind of the welcoming vibe that you really want when you're having people from all walks of life come in to your building. So it's just a lot of problems with that. Again, leaning back into the cruelty case that we had at the beginning of the year, we had a couple going on at the same time. At one point, we had 13 chickens that we were maintaining as evidence for cruelty cases. So you want to talk about we don't have enough room for dogs and cats. Now we're adding on 13 chickens. Those were in our 3rd garage bay. So we're operating over capacity, inappropriate housing for those animals. We have not enough kennels for the number of dogs coming in. So we had dogs in airline crates. It's just making it worse. And it's only going to get worse as the county's growing, as people, I think it's a good thing that people are more familiar with us and we have a positive image now in our community. The flip side of that is people are more apt to be calling us for services and help and alerting us to cruelty cases. So we're seeing those numbers increase. I don't think that the number of cruelty cases in our county has suddenly gone up. I think awareness has gone up and people are contacting us more frequently, which is a good thing. But we need that capacity in order to serve those animals and the people in our county. So overcapacity issues has led to significant changes in operations and limitations in supporting the intake needs of Will County. So we just take in stray animals. We don't even take in owner surrenders. We counsel people when they call looking to rehome their animals to see what we can do to help support and keep those animals in the home. But at the end of the day, we need to be able to have that capacity, because if people don't have that option, they make other choices. And I've been in animal welfare for over 20 years. I've seen the full bandwidth of what those choices are sometimes, and they can be really bad choices. And it's not because those people are bad. It's because they feel like they're stuck and trapped in a situation they don't know what to do. So nationally, if you look at data, owner surrenders for dogs have gone down, but inversely, stray dog numbers have gone up. And so causation versus correlation, right? the best, we'll say, that we can say based on the data, the feeling that we have collectively in animal welfare is because the private agencies, as they get filled, they're limited admission. So once they're filled, they're filled. So there's waiting lists. There's no place for those animals to go. People are just letting them go. We just had that happen end of last week, and it was caught because of Ring cameras. Some guy opened his car door and just let the dog out. And talking with him, not a bad guy. He was working in that area and he thought, this is a really nice neighborhood and I can't take care of my dog anymore. So I'm going to let it go here because it looks like a place where people would take care of it. So again, these aren't bad people making bad choices. These are good people in positions where they don't know what else to do. And I want to make sure that we're able to help them to the best of our ability. And also, I'd rather have the information on what that dog is like, what does their medical care look like, so we can better provide care for them and we're not guessing when we're trying to rehome them. So it's just a very complex issue. Other thing with overcapacity issue is that we have other municipal partners in our county that want IGAs with us. We just simply can't take any more on because we don't have enough space for the animals we already have coming in, let alone taking on more municipal contracts for villages. So as much as I'd love to say yes to everybody, we just can't unless we have the space to facilitate that. Another thing I'll point out with the space issues is that trying to figure out, again, space for adoption and be creative and like putting like pop-up cat cages like in hallways and try to create space for public versus, you know, animals on hold for cruelty cases. We can't even do that because it's a fire marshal politely told us we can't do that, which I respect, and we removed those. But again, there's only so much we can do with the bandwidth that we have. And unfortunately, I've said this, and God bless them, they still hired me. I said that on my interview over 2 years ago, and I've been asking for a budget approval so we can address this every year. And I really encourage you guys to please support us in this way so we can make these improvements that are truly needed. And again, if you haven't been to our building, please come visit. I'm happy to show you. I'm happy to talk to you more about that. But it's really, really important. Next slide, please. So looking at this, making that investment, we would meet the guidelines for the standards of care in animal shelters per the Association of Shelter Veterinarians. If you look at our housing, we fail in almost every point, which is not acceptable or okay. This would also allow for full community resources for Will County animals and the people who love them. So again, looking at things like adoption services, volunteer opportunities, people want to come and help us, which is amazing. We had abundance of t-shirts, for example, and we put on our Facebook page, who wants to make dog toys, calling out to scout troops and school groups. You can cut them into strips and make tug toys for dogs. We had scout troops as far away as Itasca driving down to pick up shirts to make toys for our animals. Like, there is a desire to want to work with us, but we don't have the space to do it. Having humane education programs. Again, I've done tours and worked with scouts and Wilco and different school groups, but there's a large desire for the youth to be engaging with our department, and we just don't have the space to facilitate that. Again, being able to provide community clinics and supportive services to keep animals in homes. I would love to be able to have better space to do that. Again, to help our residents maintain ownership of their animals, as well as dog training and behavior support programs. Again, with the intent of keeping those animals in the home. People typically want to keep their animals. They just need those supportive services in order to do so. And we want to be able to do that for them. And again, ability to increase contracts with our municipal partners to improve public health and safety in Will County. What I worry about, which I will say I know is happening in Cook County currently, if municipal villages or cities, if they don't have places to take animals, then frequently their response is no response. Then they will not respond to loose animals. They will not respond to cruelty cases because there's no places for those animals to go. Real basic level, if you look at, you're not responding to loose dogs. Frequently they're intact dogs, which means they're looking for a partner, if you will, right? But there's higher behavioral issues when you have intact animals. If you have intact animals running in packs, that's when you see significant injury or death to human. When you see those cases happen on the news, it's almost always more than one dog involved and almost always they are intact. So I worry that we're going to end up in that kind of situation. And I want to make sure that we're doing everything we can to avoid it because it's our duty to keep the community safe. So I just want to call that out as well. All right. So I know this is the final slide. Is a happy slide. I know that was a lot of information. A lot of it is kind of heavy there at the end, but just keep in mind, we are just getting started. We have a very strong staff. We have really good ideas as far as how we can serve the community. We just need that support in order to do so. So at this point, I'm happy to answer any questions that any of you may have.
Before we start that, I just want to get a couple things clear here. So your department runs on its own money that you're not coming here to ask for any money from us, but because you fall under public health and safety, and we oversee, you need our consent to spend the money that you generate on your own.
Yeah, so while we don't take any tax revenue, we don't take anything from the general fund, we're a separate special fund. Our budget process still goes through the county board for approval, so yes.
And you've had townships or municipalities that have reached out to you that you would like to service, but you can't.
Correct.
And you're saying that the available space is approximately the size of 2 small bedrooms in somebody's house to house all the animals that come through Will County.
Yes, it's not sufficient.
Okay, I just wanted to point that out to everybody. I believe Julie was waiting the longest than you.
She was.
Okay, let's see.
Thank you, Dan. So Anna, thanks for coming today. I remember when the Capital Committee first started to work on this project, the conception of the new animal control building. And yes, at that time, we had the Humane Society, we had multiple dozens of adoption programs available. So there wasn't the need to house animals. Fast forward, then we had to improvise and you had to make that adjustment with that expansion to the original building. And that leads you to where you're at now. The last time you came before the board, I had asked you about setting up a foster program and also a volunteer base to complement that. I know the Humane Society, Adopt, and several in my district in the north part of the county in DuPage, those programs, they're huge. DuPage Animal Protection Services, they have a huge foster program. In fact, my son was a foster parent for guinea pigs for many years.
Yeah.
Where have you been able to get something like that implemented?
So I will say not yet, but we do have budgeted for this year a new position to have a volunteer and foster manager. So that is set to be put into play this year.
Okay.
Yeah.
It's a great program. I mean, even seeing a member of my own family participate in it, it just, there's a lot of benefits with something like that. So that's good to hear. I have a question about the chickens you referred to. Why do you have to hold chickens from abuse cases?
So we have to go off the directive of the state's attorney's office. So when somebody is being charged with cruelty, again, animals are in the eyes of the law, that's property. So
So you have.
we
to-
have to maintain it as
Okay.
evidence depending on the case, and again, depending on the directive of the state's attorney's office. There's different things that they can do in order to release the animals sooner, but it depends on the case. It can depend on the judge and again, depending on the situation. So
Okay, and again, here's another case where if we had a foster program, the foster program could take the interim care of that animal
It-
perhaps.
it depends.
No?
It depends because the
So-
cruelty cases, again, it's evidence. So,
I'm sorry, I don't,
oh, I'm sorry. Oh, you're here.
well, I just,
I defer to our attorney.
No, absolutely not, because we wouldn't be able to establish chain of custody.
Oh, can you come to the microphone, Kevin? Thank you.
Stay there for.
Was not on my bingo card this morning.
Oh, congratulations.
Yeah, and chain of custody. So, yeah, as we started talking about, any case, we have to establish chain of custody of various evidence, and releasing evidence to a third party to manage it would be problematic for a number of reasons. As Anna said, animals are considered property under the law. So it would be no different than if we released a gun to somebody and said, hey, our evidence vault is full. Joe, can you handle the gun for a while? It has to stay within the custody of a government agent.
thank you for that. Okay, hold on a sec. Let's keep in mind, we're gonna focus on her request to get an approval for a budget. So we'll go around again and we'll come back to you, because it's 3 questions and I'm just trying to get everybody in. And then we got like 4 or 5 other people that have to speak. So, and we're running out of time. I'm sorry. Can we come back to you on that? Micah's next. And then Raquel, you had it on. Are you done? You waited long enough? Oh, I'm sorry. I saw Julie
I've
first,
been serious.
but I'm coming to you, so you put it back on.
Good morning. Thank you for coming. I think you had some of Maggie's pictures in there. They look just like her.
Yes.
So my daughter adopted from you guys, and you want to talk spoiled, but that's a whole nother story. You had a screen about spraying and neutering. Do you do rabbits?
Spay and neuter. We currently do not do spay and neuter of rabbits. We try to help facilitate them going to organizations that do. I would say it's a need. Unique thing about rabbits, it's hard for them to go under anesthesia. It's actually more complicated for them versus dogs and cats. And so there's not a lot of vets that will actually do that service.
You are
And-
correct.
And so that's our challenge. I would love to spay neuter all the rabbits because as the
They
saying
can
goes,
really reproduce.
there's a
from-
reason why there's that saying.
From what I understand, they're considered an exotic animal.
Yeah.
So,
Yeah.
but I would think a parrot would be the same.
Yeah.
The other one is, I know you touched on the housing and the rifle range, which was on my list to ask you anyway. What are your current numbers for animals being held?
So we are currently contracted with Adopt in Naperville to house our animals off-site at this time.
Oh, so if I came in to adopt, I'd have to go somewhere else?
We had to suspend our adoption program because we aren't set up to be able to do it. I know.
Okay, because
It makes me sad.
this did come up at capital improvements. Mr. Balich was asking, and I was informed that you didn't have very many animals. And so that answers why we don't have very many animals
Yeah.
there, and that the conditions are better for them, but it's also causing you issues because we can't adopt.
Yeah, and I will say that is in place as a stopgap so we can address our space needs. It is not for longevity or the end of time. So
Okay.
this gives us an opportunity to address the issues at hand, to make change in a proactive way without causing harm or impeding the care and services that we have. We are still doing the Whiskers at Work program through our location. But that's it.
And then we have animal dumping. Do they dump at your facility?
Typically, no. There's certain hotspots in the county.
Okay.
Most of them are,
Rural?
yes, where they're dumping. So we're getting a lot of strays. But again, like the one that we had last week, it was in a residential area.
So
where
if you were allowed a new building, where would you go? Because the rifle range is still there. Do you have a location in mind? I mean, do you have to buy property? I'm just curious.
Yeah, so I have a couple ideas in mind. I think overall, just looking at big picture, we'd want to be in a centralized location. So good service for our residents and our officers as far as response time. You want to be in a nicer area where families, seniors, people want to come. It should be a community destination, which it is. And think about it that way versus just another service. So it shouldn't be something that's hidden. It shouldn't be in a super industrial or crime area. You want it to be front and center. Because think about too, even with just being, doing adoptions for a year, we had people as far away as Michigan coming to adopt from us. So they're not just coming to adopt an animal, they're having an experience. What is their experience when they come to Will County? Is it one that they're gonna go back and tell people like, wow, it was really nice there? Like they have really good restaurants I saw when I drove past and like, it was great neighborhoods. That matters to the county as a whole, not just our department. So being mindful of that. Again, think about the school groups, the scout troops. Are you gonna feel comfortable dropping your kid off at that location? Or are you looking around like, oh gosh, I hope they keep them inside? Like, we want to be mindful of that. And then having the space and the bandwidth to have appropriate areas for volunteers to take the dogs out for a walk, like Julia mentioned.
But
Having
running,
the
I mean, they
space
need-
for livestock holding
Right.
if necessary.
Running
all of
for the
those things.
dogs and. yes.
Yeah.
All right, thank you.
Thank you.
Yep.
I just,
Correct.
I really want to go back to the point of this discussion,
Yeah.
if you don't mind.
Oh, go ahead.
What is it that you need? You want to expand the property that you have? You want to move to a different facility and make a bigger building? What is it exactly that you're doing as far as the building it to create more space? Yeah.
Sure. In ideal world, my recommendation would be that we move to a different location and either retrofit a building or build from scratch. And then the county can repurpose our building for another department that is in need of a new office space.
Okay.
So I'm sorry.
All right, so I know this is going long and I'm going to try and be as brief as possible. First off, I appreciate the good work that you do. You did mention that in 2024, you had 870 cases. What was your statistic for 23 and 22?
23 was similar and 22 was, I believe, 525. So we had a 51% increase from 22 to 23.
Okay. How many rabies cases do we have in the county?
As far as positive cases?
Yeah, people positive with rabies.
Oh, people, 0. Typically what we see as far as positive is bats.
Mhm.
Bats is the #1 carrier in this part of the country. And so typically if there's something that is positive, it's bats. I can't think off of the top of my head of a species besides bats that's tested positive since I've been there.
Yeah, I was unaware of any dog
So
bites.
this is the second carrier, but there hasn't been any positive skunks since I've been.
So what I'm hearing is that right now is space is the constraint. That's your biggest challenge.
Yes.
Obviously, there are some things that Kevin brought up and that we have to deal with. But there are a bunch of volunteer groups I know just in my community, TLC, NAWS, PAWS, and all that kind of stuff, that do have the ability to, they already have everything in place to do that. And maybe this is a situation where we provide them with a little bit of funding and they can expand their facility a little bit to handle some of these things. So you're not pushing them out. We're not having to do a multi-million-dollar build out immediately. So something to think about, and I don't want to drag this on any more
So
than
I
that.
just
So-
want to touch on that real quick. We do work with partners like that. The problem is they're full.
But so if we
And
were
the
to give
challenge
them,
is also with some of those organizations is they're pulling from out of the area and that's their mission and their board of directors have expressed a desire to pull animals from Southern Illinois or to pull from out of state. And so unless you are going to completely change their philosophy on how they approach things, it's going to be very challenging to just give them money and have them expand. So we value collaboration and collaborative approaches and we work very well with all the organizations in the area. But I don't want you to think that doing so will resolve the issue because it won't.
just throwing things out there,
No, I
because that's not
appreciate
my profession. My profession is computers,
Oh, well,
and statistics.
I appreciate you
So
more.
how many, what is your staffing level at this point in time?
as far as.
full-time employees?
So we have 4 animal control officers, our field services supervisor. Those are the ones that handle everything out in the field. And then we have a variety of other administrative.
Is based on what I calculate based off your healthcare costs is you've got about 14 people? Is that accurate?
Yes, that's
Okay.
around.
Bringing up buildings, we do have the Pace Building, big facility. I believe there's some grassy areas there. It's right in downtown. It's fitting all the things that you have just discussed, and it's massive. To do a build out inside there would be something that I would say should be considered or looked at. And we can go from there. So I'm not going to talk anymore.
Yeah.
Okay,
I'm going to move
thank you.
on.
I
right.
appreciate the recommendation.
Thank you. And I believe, just don't want to go over this one more time. You don't receive money out of our budget.
That is correct.
You get all your money through people who own pets, who pay for rabies tags to protect us from bats that have rabies that bite their animals that could attack us. Is that
That's our
correct?
primary source of revenue, yes.
So basically, you're just, you haven't put in it formally, so I'm going to ask you to come back and formally make a proposal that we would recommend for you to get. I know what you're asking for, but I would like for us to be able to do that this meeting, but I believe that it has to be done through a formal
Okay. It is in the
asking.
capital request for this year's budget.
Yes,
That's-
and
that's
that
gonna call that out, yeah.
definitely, I get, just listening to people around here, I get a pretty good idea that pretty much people are in favor of that, but, maybe can you just consider that next month?
Okay.
You'll be back,
Sure.
and then, you could propose that for us.
Okay.
Julie, you had something else you wanted to say?
Chuck, Tuesday, I had made a comment that the Pace Building was the perfect opportunity for us. And I also, I think I asked if this was a good reason to put this subject on either capital or have you thought about that? Because I think to just push this off and then have it come before public health and safety again, this is a capital issue, or I don't know, executive, but I think it needs to go
Excuse me,
to, if we're,
this falls under public health and safety,
I-
and they have their own money. They're not asking us for money.
it's
All
still
they're
going to
asking
come to
for-
the board, Dan.
I
It
know,
has
but
to
this
come to
is-
the right
this is the
committee.
appropriate channel that we're taking.
Chuck, can you comment on that, please?
Yeah, I'll be happy to work with the chair here. I'll be happy to work with the speaker as well. You know, we work at the direction of both individuals and we'll find an appropriate place for this to land. Obviously, the chairman here would like to see a proposal come back to this committee. That seems to be a preference. You know, it might fall under Chair Freeman's jurisdiction as well as the chair of capital improvements. But again, I'll work with all parties to talk about that and make sure it lands in an appropriate place.
Thank you. Appreciate that.
Okay, well, thank you very much for your presentation. It was very informative. I'm sure a lot of people didn't realize that you pretty much generated all your own money to pay for your program.
I am happy to take county money anytime for the record, but yes, we work very hard to be self-sufficient. Thank you so much for your time. If you guys have any follow-up questions, or like I said, if you want to stop by, feel free to email me or pop in anytime. I'm happy to give you a tour. Thank you so much for your time.
All right, thank you again. Okay, so next on the agenda is the presentation for financial impact of grant reductions on the health department with Elizabeth Bellata. Could you hit yeah, either one.
All right. Thank you. Once again, I'm Elizabeth with the Will County Health Department, and who I have with me today is Denise Bergen. She is the Assistant Executive Director, and we have Sylvia Muniz, who is the Director of Family Health Services. And in your packet, you did get a PowerPoint from us and also an impact statement. And later in this presentation, I will be passing out a letter of support that is signed by our Board of Health members. So thank you again for letting us present to the Public Health and Safety Committee on our grant reductions. and the request for additional levy money to support several critical positions in our Family Health Services Division. We appreciate your time, and we ask for the individuals that have already heard this to please bear with us and be patient as we go through this again. As stated in our impact statement, which you have, public health has been underfunded for years throughout the county, so it's no different in Illinois. And during the pandemic, we realized that. And so we scrambled to hire temporary, part-time, and full-time individuals to help with our response to the pandemic. And we quickly realized that a lot of those positions should have been at the health department already. Our funders saw this too, and we got some additional grants in addition to ARPA during and after COVID. One was the Respiratory Surveillance Outbreak Response Grant, which was to continue surveillance and outbreak response efforts at the public health level. We also received Strengthening Illinois Public Health Administration Grant, which was to assist local health departments in building the workforce for public health. And then we also received the Disease Intervention Specialist Workforce Development Grant. I don't know why they named them so many words, but anyway, to strengthen the disease intervention specialist workforce and to train them so that we're ready for the next incident. Unfortunately, these grants were not recurring, and so they let us build up our workforce and then for a very short time. This county has a wonderful health department and community health center. We have amazing staff. Some of our staff have been here 5, 10, 15, 35 years. They live in the community and they serve residents of this community. And of course, we want to continue to serve the residents at the level that we are serving them now. But we want you guys, the board, the county board, to be proud of the services that we do. That's why we come here every month. That's why we invite you to our health department and we give you tours, because we want you to know who we are and what we do. And we want you to be our advocate out there with the constituents. That's what we've asked our Board of Health and our governing council to also do. Over the past 2 years, we have made significant positive improvements to the health department and the community health center, including in family health services, in the services that we provide and the number of people that we impact. So of course, we want to maintain that level. But we also know that when funding ends, we do have to let the programs go. And we had 2 recent eliminations, one from our Emergency Preparedness Division and one from our Family Health Services Division for the Well Woman Grant. But also in the past, we have looked at our grants and our programs and eliminated them and the positions as needed. For example, health, vision and hearing was eliminated in 2023. The lead poison prevention case management program was eliminated in 23, and the crisis care system out of our behavioral health division was eliminated in 25. Those services were turned back over to entities in the community. However, we are here requesting some levy money to retain some of the most critical positions that were added to family health services. The CEO of NACHO, which is National Association of County and City Health Officials, said, "The pandemic showed us what a stronger public health system could look like. Public health threats are not going away. They were returning at even to a more weakened system, just as chronic health challenges, opioid overdoses, maternal health issues, and future outbreaks demand more, not less, of the local public health department." Public health takes all of us, and it's for all of us. It's local, it's relational, and it's collaborative. So here I am with our 2 individuals that I'm going to turn it over to, but I do want to hand out really quickly the letter from our Board of Health in support of our request. So here, if you would like to take a copy and pass it around. I will have Sylvia go through the PowerPoint and the impact statement, and I will have Denise go over the financial impact of our request. Thank you. Sylvia, could you introduce yourself, please?
Good morning. My name is Sylvia Muniz. I am the Director of Family Health Services at the Will County Health Department. I've been a nurse for nearly 30 years. All my background is in maternal child health, with about 18 years in the hospital before coming to the health department for the last 10 years. Family Health Services is a division composed of mostly population health and maternal child health programs. And we have a staff of nearly 90. So on our PowerPoint, I just want to highlight a few things. Thank you. Highlight a few things about our programs and the impact that some of these cuts will have. Regarding our maternal child health programs, we have case management services that are unique to our programming because they are done by nurses. Other agencies might utilize home visitors that do not necessarily have that medical background to provide the services to the extent that we do. So our services serve high-risk infants and high-risk pregnant women that are babies that perhaps were born prematurely, drug exposed, maybe with a genetic condition or a heart defect. And our moms, our pregnant women may be at risk for preterm delivery, preeclampsia, postpartum complications such as hemorrhage or infant loss. We also serve children in DCFS care and babies that were born exposed to Hep B. We provide support to these families, a lot of education, referrals to resources within the community, and basically skills that are sustainable for them to cope, resolve their own issues. We do not solve problems for people. We can't do that. But we teach them and we provide them with those resources for them to go run out and do that. With the reduction in staffing, we could potentially lose 3 full-time nurses and our case management assistant. And this would affect, could potentially lead to an increase in maternal and infant mortality and morbidity. One of our stories, then you guys may have heard, some of you have heard these stories already, but I can talk to you about Ashley. Ashley was a 19-year-old pregnant woman and she was in an abusive relationship. She lost her job early on in the pregnancy and that impacted her ability to pay her rent and her utilities. Her boyfriend was not financially supportive and the relationship with her mother was strained because of the abusive boyfriend. She also had pests in her apartment that the landlord was not addressing. In addition to the usual prenatal education that we provided, the nurse gave her several resources which Ashley utilized to improve her situation. She felt empowered and advocated for herself. She went on to deliver a healthy baby at term and visited the nurse about a year later. She stated that she had left the abusive relationship, reconciled with her mother, moved out of that apartment, and she was working part-time and started taking business classes at JJC. She thanked the nurse for her help, and the nurse reminded Ashley that she had done all the work for herself and her baby. She stated that she just wanted to give him a good life. And again, it was a case of just the nurse providing her with the resources, the tools that were sustainable for Ashley to go on and take care of her family. That was our high-risk pregnancy program. Within our high-risk infant program, which these two are actually now combined, which is a whole other story, we had an infant, baby Rosie, we're going to call her. And during a routine home visit, our nurse, Nicole, was visiting Rosie, who was medically complex. She was fragile, and it was a routine visit. And she noticed that the baby was having some respiratory distress. Again, based on her assessment, her nursing assessment, she advised the mother, does this baby need to go into the emergency room? Does she need perhaps some care? And the mother had said, yes, actually, I took her to the pediatrician yesterday, and the pediatrician said she was fine. However, she's not improving. She's actually getting worse. So again, Nicole reminded her, hey, you are within your power to go ahead and take her to the ER to get another assessment by a physician. And she did that. And when she got there, the baby was actually transferred to another hospital to receive a higher level of care that required oxygen and antibiotics. So again, this was a nurse, our nurse in the home completing her assessment. And based on her assessment, this baby required additional care. And the mom ran with it. That's just 2 cases in our maternal child program. Within our immunizations program, can you go to the next slide, please? Our immunizations program provides children and adult vaccines. We have a homebound program, international travel program. We provide immunization clinics at schools, community health fairs, community events, and a lot of outreach and education activities have been taking place. We are at risk of losing 2 full-time nurses, a nurse manager and a clerk. And that would eliminate our homebound program. It would eliminate some of our all of our community events, we would actually have to reduce the amount of appointments we can provide in our offices, including our satellite offices in Bolingbrook and Moni. Our homebound program impacted one family, one particular family in a manner not that you would probably consider. A homebound vaccine visit for a disabled gentleman and his wife turned into multidisciplinary care for the entire family. This man needed vaccines in the spring of 2023 while they were staying at a hotel. Upon arrival of the homebound staff, it was noted that the wife was playing with 3 grandchildren, ages 7, 4, and 2. When asked if they had the day off of school, the oldest child hesitated and said, "I don't go to school." The nurse talked with the grandmother during the vaccine visit. Grandmother stated that she homeschooled the granddaughter. Further discussion revealed that the grandparents had lost their home when the grandfather hurt his back. His prosthetic leg was inadequate as it no longer fits the injury, and he was unable to work. Upon return to the health department, immunization nurses went to speak with our resource coordinator. She was working with the homeless at the time. When concerns were discussed regarding homelessness and the grandchildren living with them, and the children not going to school, the program McKinney-Vento was discussed. We spoke with other agencies who had actually already the couple on their radar. Our resource coordinator contacted the couple who were the physical guardians of the children, but not the legal guardians. After a multi-agency meeting, the family received help in caring for their grandchildren. The 7-year-old who had never attended school, she should have been in 2nd grade, okay, never attended school, was registered and picked up by the school bus for the last 2 weeks of school. In following up with vaccines the next year, the 2 children were registered. So now the ones that were 7 and 4 years old, they were going to school and making friends. And this is just one family that was a homebound vaccine visit, nothing to do with anything else but shots. And this is how this family was impacted. And we will lose this program with our reduction in nurses. Next slide, please. Communicable disease is our silent program that people don't really know about. We have communicable disease investigators that do just that. They investigate cases that are reported through the Illinois Department of Public Health. These include outbreak investigations that occur at daycare and school facilities, long-term care facilities, or food establishments like restaurants. They ensure appropriate surveillance, treatment, compliance, and reporting. So this does include contact tracing that kind of became famous during COVID, but this is something that we had always been doing. We are at risk of losing half of our staff, 4 of our CDIs, communicable disease investigators. And what this would result in is a reduction of services and response time due to less staff to take the calls. We would not be able to conduct our infectious disease prevention and mitigation program at our long-term care facilities. We would just not be able to provide that education because we would be busy taking calls, just handling our regular disease investigations. And ultimately, this could lead potentially to increased mortality and morbidity of Will County residents because of our inability to mitigate and prevent infections or outbreaks. Next slide, please. And I do want to highlight that CDI, Communicable Disease Program, services the entire county. This is not one particular population. This is not one particular zip code. This is everybody that lives in Will County. People travel, people can get exposed to anything at any time. So we respond to those calls. And again, everybody in Will County does not really understand that, but we all need our CD program. Our HIV and STI program. We provide HIV and sexually transmitted infection testing. We connect to treatment. We help provide PrEP, which is pre-exposure prophylaxis, which the goal of that is to, the goal of positive is to become undetectable, which then means you can't spread HIV. We provide case management and linkage to care for our HIV positive patients. Lots of community education and outreach, rapid testing, and then again, additional investigations and partner notifications. we are at risk of losing 2 nurses and our HIV STI manager once this funding is expired. And this will cut back on our testing. This will cut back on our outreach and education services. And then this could lead to a potential increase in HIV positive cases, STIs, which include transmission to newborns. One story that I would like to highlight is about our client, Mr. B. Mr. B contacted our manager, Kendra, through a social media program regarding HIV testing. And they stayed in touch for several weeks. He was planning to come in for testing, but he never followed through. He was really just nervous about the results. Each time he missed an appointment, Kendra gently reminded him that she was still present and he was welcome to come in whenever he felt ready. She reassured him that she would guide him through the process step by step. Eventually, Mr. B finally found the courage to come in. However, when he did come in, we had to deliver bad news that his HIV test was positive. After he left the building, a more experienced staff person followed up and reached out to him. Mr. B confided in her that he regretted testing with us because he felt overwhelmed and stressed with his results, but she reassured him and encouraged him to continue to return. Since that moment, Mr. B has remained connected with our clinic and committed to his treatment. He's been diligent about taking his medication, and he reaches out anytime he has questions or needs support. Without our services, Mr. B might not have learned his status, and he wouldn't be on the path that he is now, working toward becoming undetectable and unable to spread the disease. His story is a powerful reminder of what compassionate care, teamwork, and persistence can achieve. Again, one person impacted by this program that could potentially be a reduction in services and could lead to more spread. So I just wanted to, remind everybody that, what are we asking for, $1 million? It's just, petty cash, right? The problem is decreased funding will result in decreased services. And we learned during COVID that we were severely short-staffed. And when we lose these services, we're going to be sent back to pre-COVID times. And that's not good for anybody in the community, anybody in Will County, anybody in the country. And so that is what, we strive for, and that is what we hope to get the point across.
So I'd like to turn it over to Denise to go over the financial components, and here is the cost.
All right, so Sylvie has covered the 4 programs that we're looking to preserve staffing in. These are core foundational public health programs impacting maternal child health and to stop the spread of disease under HIV, immunization, and STI, communicable disease. Right now, we have a total of 15 staff that are at risk. We've evaluated the program and we're trying to retain 11 of them at a cost of $1 million. That includes salary and full-time benefits that they are entitled to as full-time county employees. On each slide, we understand this is a very large request. And on each slide, we've indicated the number of people that we would like to retain and the cost of retaining it by program.
And in the slides and on the impact statement, we did try to elaborate on the numbers that are impacted by the program so that you could get maybe a full overview of how these programs do operate. Thank you again for letting us present. These are just critical programs for battling the current public health crises.
And thank you very much. And with that, we have some questions. Micah?
Just really quick, when was the last time you came to ask for any kind of increase in your levy?
So our last levy increase was in 2023. We did receive $1 million. Prior to that, our increase was in 2018. We received about $360,000. Over the past 10 years, our levy increase is about 14%, while our budget increase is about 48%. So we have supported a lot of the growth within the health department through grants and through fees. Our programs, some have grown, some have gone away as the need in the community has warranted. The costs are increasing. In the past 10 years, group insurances for the county It's increased by about 13.5%. We've absorbed that cost. You know, we do try to be very conservative and be good stewards of the money that you do entrust to us.
So back in 2023, did you get the full amount that you had requested?
In 2023, yes, we did.
Okay. But I remember the 708 board was coming to your rescue for,
Right.
Close
Now,
to $3
that was
million.
the last time that the CBA was up for negotiations, our collective bargaining agreement. And what happens is typically what is agreed to in the county executive's contract extends to the rest of the contracts. So we did come forward during negotiations to say, look, we do not know how we are going to fund these increases. And at that time, we were given 708 funding to support our behavioral health department, expansion of our behavioral health program, which allowed us to redirect existing levy funds to support core public health.
and didn't you move money around because 708 money can only go to like behavioral health and
Absolutely.
so there's a lot of, not much wiggle room if I'm correct.
That is
As to
correct.
where money can be wiggled around.
Very specific, 708 board money is very specific. You are correct.
Okay, so I appreciate that. And I sit on the health board. So you know, I am in support because I do see the need. So that was all. I was just curious about the last time you had asked. Thank you.
Thank you.
Julie?
Thank you, Chair Butler. So you've received 4 million from the Mental Health Board, I believe. Is it 1 or 2 years now?
Our first year, we received 4 million. Second and third year, we're slated to receive 3.75 million. We have expanded staffing with that funds. We've added 11 school-based counselors throughout the county. We've added 5 mental health counselors in adult services and child and adolescents. We have added an intake department to better serve calls that come in. We've added some support staff management and clerical and interpreters to handle the increase in clients. Our wait time, I think people can get an appointment within 1 week, and we've added psychiatric services. Those are very hard to come by in the county when you're on Medicaid or uninsured. We've added psychiatrists and advanced practice nurses to meet the needs of the community.
And these were all things that as, to give, you know, the 708 board had asked us to expand in certain areas at our North Branch and especially in school-based programs. So we present to them on a monthly basis. They review the budget and we discuss with them how, you know, what growth are they looking for? Where are the gaps in the county? And that's why we had expanded services.
Do you provide that information as well to the county board?
Our budget, our budget for our whole agency is provided through the county board, yes.
Okay.
I would love to see that presentation that you provide the mental health board.
We have the budget right here if you would
Also,
like. to-
shared with the county board members. That would, I also would entertain maybe in the future, we could also have that same presentation. I do have a question. So our population hasn't increased very much through the years. So where do you see the increase in the demand of service coming from? Where is that demand coming from?
Correct. Sylvia, maybe you can even speak to the increase, and since we are looking for funding to support family health services, where are the increases coming from?
I think people are just finding out more information and able to access some of this more readily than previously. Specifically, do you mean like types of programming or specifically, what exactly are you looking for?
The demand in general. If we're getting more and more need for services.
So I think a lot of COVID taught us, or a lot of what happened during COVID, people were isolated for a long time. So I know a lot of mental health issues sprung upon that. A lot of people started to, you had a lot of job loss that happened. So we had people coming more, reaching out to us to utilize more of those WIC services. People were requesting more assistance with signing up, for example, for Medicaid and SNAP services. So, and because of that isolation, people were just reaching for somebody to hear them out. And having a nurse there to do that was valuable to a lot of our families that found themselves with no support during that time. And it's become a more prevalent that I think people have are more freely utilizing services than they had. I don't know if that actually answers. your
I do want
question.
to add a few things to that. So we've also seen an increase in substance use within the county. That is one of our indicators on the I-Plan evaluating the county health. And with respect to our DCFS kids, we've seen a large increase in our caseload of children entering the DCFS program. Certainly, we do not know the reason, but since COVID, that caseload that has been assigned to us has dramatically increased.
Thank you very much. I'm just saying, I just want to give Kelly an opportunity to ask a question, and I want to go around at least once, and then we'll come back. I like everybody to speak, but Robert's Rules of Order, try to get the most questions answered in the least amount of time. Kelly?
Thank you very much. Thank you for your presentation. I'm trying to understand, you're expecting 708 funds. So this would be the second year, is that correct?
So we received 708 funds in 2024, county fiscal year 24. We received $4 million. And when we spoke to the 708 board, we said, look, if you give us money to expand, you need to keep giving funds to us because we can't, some of these services we can't bill for, engagement, things like that. They're not billable services. You can't fund us to expand and not follow up with that because all the strides that we have made will be lost. So they understood that. The first year, 24, was $4 million. Our second year is 3.75. And for 2026, we're budgeting 3.75 as well. Million.
Okay. And that is with the agreement of, I'm so sorry that the president had to leave before we got here, but
Yes,
that is the
correct.
agreement.
Yes,
Okay.
we had to present our, not only every budget we've had to present to the 708 board. So for 26, we did present the budget to them and they approved it in their meeting.
Yeah.
Yes.
Okay, great. What I'm understanding is if these programs that you've listed here go away, there isn't necessarily the same level of support within the community for these programs, or they don't have the capacity to absorb.
So some of the programs, okay, so what we will do and what we have to do all the time is we have to look at our programs and then look at the community and see, are there other entities that can take the programs? For example, with Vision and Hearing, when we were looking at that program, we saw that the schools had individuals that could do the testing or they could go to their own eye doctor. So yes, as these programs mature and as the funding goes, we have to do a critical review. We call it a program review, basically, and see how much does it cost? How many staff members do we have? Who else supplies that or that provides that service in the community? If it is not provided, then we do need to retain it. If it is provided, then we can look to outsource some of it or work with our partners. For example, for this 590, which is crisis care, we realized that we were struggling to hire individuals to work a 24/7 shift. It just was not in our wheelhouse. We looked to Trinity Services. They were able to take the program. So we backed out of 590. So we have to eliminate that program. They took it over seamlessly. So it will be a balance of which programs can we only provide and which programs can be provided. Denise, I know you've done some of the background of this too.
No, so there's certain programs here that are only provided by the health department. Communicable disease, the state of Illinois reaches out to us when they have communicable disease, when they've been notified by a private provider. It is our responsibility as a certified local health department to follow up on that case. Same with our sexually transmitted infections. Local providers submit those reports to us and to the IDPH lab or IDPH. And it is our responsibility to do the contact tracing to make sure that that disease is not spread among the community. So again, these are core public health as a certified local health department. They're activities that we are responsible for our community. Immunizations, certainly other providers in the community provide immunizations. There are other providers for vaccine for children. Not a whole lot. It's a cumbersome program. We are the only provider in Will County that is a participant in the adult immunization program, where we receive free vaccines from the state and from CDC for uninsured, underinsured adults. We are the only provider who does that. The majority of the vaccine we provide to the community, 85% of it is that free and reduced cost vaccine, because that's where our population is at. We treat the uninsured, the underinsured. We're the safety net in that program, and it is to stop the spread of disease. Again, one of the core foundational public health needs. What am I missing? Maternal child health. Yes, I'm sorry. You're fine.
Okay.
Can I just one more? I'm sorry.
Okay.
I'm sorry.
Oh, hold on a second. I pressed the wrong button. Let's start over. Ladies, could you please, in case, I just want to get them all. Oh,
Thank you. Thank you so much. I'll be brief. I just, I was kind of looking, we're stewards of the public's funds, and we want to make sure that we're making the best decisions here. And so I kind of looked up what happens when public health programs like the ones that you outlined are redlined, and it looks like, I'm really dating myself, but like the worst Fabergé shampoo commercial ever. Like, you told two friends and so on and so on. It's health goes down and down and down. So what I'm hearing you say is that the programs that you're highlighting here are an ounce of prevention instead of a pound of cure. And I hope that we can find a way to support this. So thank you very much.
Thank you. Jim, I know you've been patiently waiting. I accidentally clicked you off.
Thank you very much. I'll try and be brief again. Well, first off, I mean, yes, health is probably the most important thing for anybody to survive in that. But no matter whether you're a household, you're a business, or your government, you have to look at and do a reevaluation on a regular basis of how I'm spending my money. Is it the most useful spend of the money? Is there a way to do some kind of consolidation? Because I keep hearing, we're going to have to eliminate this number of nurses, this number of nurses. I know nurses are probably the hardest working people in a hospital or a medical infrastructure. That is there a way to right size some of these, combine these programs and that to where they're being fully utilized? Because my question is everybody working at 100% utilization? Wow, we should, you know what? I would love to have you come to my business, because I would love to get everybody working at 100% utilization. So, but, and
Yeah, go ahead.
just to answer my question. So here's the next thing too is, I'm assuming everybody you treat is a resident of our county. So nobody's from outside our county? Nobody's from outside our state?
With respect to our immunization
No, I'm
program,
talking overall. Every service you provide, are they a Will County resident?
no, I cannot say that.
So they come from other counties,
They could.
they come from other states. How about other countries
They
that aren't
could.
even here? They don't even belong here.
And I
Majority.
understand.
Yes.
With respect to our communicable disease program, our SDI program, our immunization
I'm
program,
talking overall, just
right, but with respect to these programs, it's population health. And we provide those services because they're coming into this country and they could have a disease, they could have something. We are going to treat them to stop the spread. So within those programs, we don't capture population zip code information, documentation information. Certainly in other programs where we provide, they come to our doctors, they come to our counselors, we would gather more information.
so we're basically supporting healthcare for anybody in the world, for some individuals.
If anyone comes to the Will County Health Department at this point, we are the safety net provider.
Okay.
I will say that we will follow the federal mandate as it is released. And this is one of the things that is coming down from the federal government, the personal responsibility and work opportunity. They are redefining, reinterpreting what a federal benefit is. And so certain programs could be added to that. Previously, your Medicare, your Social Security, those were public benefits only for legal citizens. So what they're doing is they're reinterpreting that, and they're going to be adding, they're looking to add FQHC services. They're looking to add community mental health services. So if this goes through, we will receive guidance where we will have to verify citizenship. We will comply with whatever statute is passed down to us. At
So,
this
that's
time,
fine. I'm not asking you again for a
Right.
political debate.
no,
Because
I'm
what I-
just
what I
saying
want to
at
do is
this
drill down into
time.
immunizations thing,
Mhm.
is because during COVID, you were able to let firemen and that, and a lot of other people give immunizations. Maybe one of the things that we can do is look to work with some of these local fire departments and firemen and have them be providing some of these services throughout their organizations too. You talked about, reaching out into the community and all that kind of stuff. If they're technically allowed to do it, maybe under the supervision of your health department, you can actually reach out to more of these community members, because the local firehouse is a lot closer to the resident than you are.
I believe that was an emergency,
And I-
order.
Authorization.
Thank you, authorization.
The emergency authorization empowered lots of different entities, including the fire departments and the fire stations, to provide the COVID vaccine.
I'm just trying to
and it
figure out a
did
way for you
expire,
to reach
but-
more people cost effectively.
Of
And
course.
because anytime government is closer to the people, it's going to be more efficient and effective. So that's all. Thanks, Dan.
Julie.
Thank you, Chair Butler. So Elizabeth, I think you mentioned DCFS and the care you had to provide to children in those cases. Are we getting financial support from the state to pay for the cost of this service?
So with respect to our DCFS caseload, yes, we are a contracted provider. We do receive funds, grant funds from the DCFS contractor
Does
for
it
the state of
pay-
Illinois.
Does it pay for all of the expenses, or is Will County subsidizing DCFS services?
I would,
What those
Let's
services, let me
explain
just
what the
explain what the
services are.
services are. Those are case management services done telephonically. So we reach out, we are notified by DCFS when we have new kids in foster care, and we reach out to these foster parents to help guide them through the healthcare system, the whole process of the child's medical care, to ensure that they are getting their basic medical care, their well child visits, immunizations, eye
Is this done
exams, dental.
remotely? Or
This
do
is,
you-
this is telephonically. So yeah, they're in the office
Everything.
doing.
So-
Yeah, that's
so
what
you're-
we're doing for DCFS. We're
Okay.
not doing any
But
kind
then
of
you
decision
need a
making.
staff member, a nurse, or whoever, and that time equates to a cost. We have to pay that person's salaries and benefits. My question is the state reimbursing us for every penny that program costs us?
I would say at this point, no, there is a portion that we are supporting through levy funding.
So that is an issue that needs to be put on our legislative agenda, because the state needs to, this shouldn't be on the backs of the Will County taxpayers. So Chuck, I'd like to have that put on legislative. And then, okay, thank you.
Okay. Any other questions for our guests? Kelly, hang on a second. Let me, I'm a little slow, but I get there.
I appreciate it. When it comes to the cost of immunization versus the cost of potentially having something like whooping cough, which one of my dear friends had a couple of years ago and was out of commission for weeks and weeks and weeks, could not work. I don't know where she caught that from. I don't know who it was. I don't know where they lived. But I think that she would have much rather paid for the immunization than have those 6 weeks. is that something, I mean, that if cost effectively, how does that pan out, do you think? I'm sorry, Denise, I'm asking you a really
Our
wide range
financial
question.
director.
No,
I mean, even two measles cases, and I can refer to Sylvia on this, even just two measles cases that we had last year were thousands of man hours because of all the individuals they interacted with. So it does escalate. You don't realize all of the contacts. So for any case, and you're working it and all those contacts that you have to research, it is a huge man hours. Sylvia, did you have something? I apologize. I jumped
I'm
in.
going to tell you, I'm looking at the cost of our Tdap, which is the adult vaccine.
Okay.
$125.
Okay.
Is
I
what
can
the cost of the
safely say
vaccine.
that in 6 weeks, she would have made more than
Yeah, I think so.
100. So thank you very much for the information. I appreciate it. Thank you for coming again. I really appreciate your time.
All right, well, thank you. I mean, you're still going to be speaking here, so do you have informational reports? Are we just attaching that or were you speaking?
It is in your packet, our normal report. The only thing I wanted to add was that, just, you can see all of the events that our health equity manager has been attending. As I stated, I think in finance, health equity was out this weekend. They were at 4 events at the same time. So we are in the community trying to get them to know all of our services. The other thing I just wanted to mention is that this week is National Health Center Week, August 3rd through August 9th. And their theme is America's Health Center, celebrating the past, present, and future. I also had included in our packet the opening of our second Milk Depot and some pictures from that event that was at our Bolingbrook office. And then I just wanted to highlight also that our environmental division was interviewed on June 26th by CBS News, and it aired on July 10th. And it was a story about West Nile and what the interns do. So we got some nice press on that. So I'm not sure if you had a chance to look at it. I believe I provided you with the link. So.
So thank you. I appreciate it. I can see how you're trying to move really fast. Kath, don't you have something for us or no? Just entered into the record here? Your
That's-
next For substance use initiative?
Oh, that's Dr.
Oh,
Burke.
I'm sorry. Oh,
You're good. Yeah. This is Denise Bergen,
I'm sorry.
our financial guru.
My bad.
Good afternoon, and I will keep this brief. All I wanted to
I
point out,
want to give you your due time, so.
no, and everybody has the report, so it's, all the statistics are in there. We are continue to reduce our opioid overdose deaths. We are monitoring drug deaths now. You'll see another additional chart that's been added because we want to monitor to make sure we're not seeing a transfer of people's use and death. The last death was cocaine when I talked to the coroner. So we monitor, but overall it's down. So we're very happy about that. Then we just rolled out 10 more red boxes for across the community. Next report will have all the locations and how that's going, which means we'll be distributing Narcan even more broadly. And then I wanted to let you know that this is Overdose Awareness Month and that our Lincoln Light Still Shines annual conference is August 28th from 5 to 8 at Lincoln Way West. And then the final thing was, for some of you may have seen it, the FDA is now requiring changes to opioid pain medication labeling. Basically, what they're going to do now is to warn the consumer of the dangers of if you are on an opioid long-term, and some people are. They're going to make the information clearer so that someone would easily understand what's happening, why they're giving them information. They're going to give them dosing warnings so that people know you can't keep kicking up your dose, even if you're in pain, that could create an overdose. They're removing the language that could be misinterpreted to support using opioid medications over indefinitely long duration. So we're trying to get it shortened. And also the labeling is for safe discontinuation, because that's the other thing people have to understand. If you are going to stop taking it, you need to take that slowly. And if you haven't received that information from your doctor, it'll now be on the medication itself so that you'll have the information. It will also tell you about Narcan, overdose reversal, or naloxone, and any drug interactions, because that's another place that we're seeing overdoses is the drug interactions. And then just what the risks are overall for that specific drug that you might be taking and what the impact that is on you as an individual. And that's it. Any questions about that? I just want to let people know that.
Yeah, we have one question. from Mike.
Just a really quick one. It was on the new drug that can be found in vape shops.
Yes.
Can you kind of give me a highlight on that really quick? It was the one screen down, Tim, the other way. There you go.
The hydro,
Is it Kratom or
Kratom?
Kratom?
Kratom's been in the vape shops for a while.
And they sneak it in? How is
It's
this?
legal. It's not an illegal drug. It's not regulated in any way.
It's plant-based. It's the Delta H THC.
Right. That's different than Kratom, but it's still, it's not cannabis. It's the active ingredient weakened in cannabis.
Okay.
And there is no legal prevention of people from selling that in the law. There has to be definition that that particular strength is illegal or it needs to be monitored, and that's not there. So because of that, the smoke shops take full advantage of that.
So when you say a psychoactive
Cannabinoid.
thank you. When I think psychoactive, I'm not going to tell you what I'm thinking. What does it really mean?
Well, it does mean that you may have alteration of your consciousness. And so it can do that, and especially depending on how much you're taking, it can have that kind of effect.
This isn't good.
No, it's not good. Most of what a smoke shop sells isn't good. So.
Well, that's true.
But they're also really hard to close them down.
Because I wasn't really clear, and so I wanted to
No,
have better knowledge on that one. Thank you.
Right, well, thank you very much.
thank you.
Last but not least, from Sunny Hill Nursing Home, Maggie McDowell.
Good morning, almost afternoon. So I'm going to make it very brief. Everybody got my my updates. So if anybody has any questions, I'm here to answer those. So like I said, I want to get everybody out of here as soon as possible. I'm getting used to this now every month.
Well, we don't want you to think that we don't pay attention. So Micah has a question for you.
I do. So two West Niles was found, one behind Sunny Hill and one behind the.
Actually, and
Health
now it's
services.
3. Since I actually
Okay.
sent this report, there was another case behind Sunny Hill.
So did they spray, treat?
The health department, they're interns, I believe. I did get, they send me an update, when they determine this. And again, they give, like I outlined in my report, they give us, an overview of kind of what steps and measures to take. And again, and of course, our residents don't typically sit out in the evening hours, but on occasion they may with family, sit out on one of the patio areas. We just make sure that they have the spray, and that the nurses apply that if they're going to be outside in the evening hours. But it's something to be aware of because that's 2 positive cases. One by the health department, by the CHC,
Right.
but the other 2 were directly behind Sunny Hill. So that is a concern
right in
because
your
we have
area.
that lower level patio area, where, you just never know. And of course, our residents are fragile and vulnerable, and we have to take appropriate measures.
All right, thank you.
Okay, Mr. Richmond.
So Matt,
I didn't get you?
Mhm.
number 9. So Maggie, I know I wanted to get out and visit your facility, but you had some issues with health and all that kind of
Yeah.
stuff of the residents, not yourself, which is good. Can we now come out there and visit you guys again?
Yes, absolutely. I think you and Dan missed when everybody else came out on the 9th of May for a visit.
Yeah.
But certainly you let me know a date and a time and I will make myself available and I'll give you the tour.
Okay, excellent. Thank you very much.
No
Perfect.
problem. Any other questions?
No other questions?
Okay, thank you so much.
Thank you very much. Is there any public comment? No public comment? From the hall, if no one's online? Okay, announcements, by chair. I do have a little bit of an announcement. You know, as we can tell, this went on for quite some time, and I really feel like with a little bit more efficient use of our time, this could have been done earlier. So I'm asking the members to keep the questions to just questions in the future, not long stories. And if questions have already been answered, don't ask them again. If someone has a list of questions and they're just asking a question, answer, I don't mind. But I don't want long stories because obviously was landfill after this? I mean, yeah, so we got to try to keep it on time and I really think with a little more effort, we could. So let's all be considerate of everybody else's time. Obviously, the goal is to answer as many questions in the least amount of time. So with that being said, and I don't believe there's any executive session, so can I get a motion to adjourn?
Motion Freeman.
All in favor? Motion passed.